Hello, welcome to the effects of music therapy on patients with dementia. This is Group 5. In this presentation, we are going to be discussing the abstract, the research for effects of music therapy on patients with dementia, the impact for nursing, and concluding remarks.
This presentation examines the impact of music therapy on symptoms and behaviors of patients with dementia in different environmental settings. Although previous studies addressed this topic and proved a small improvement, new research revealed rather a larger positive impact not only in patient symptoms and behaviors, but also their relationship with their significant other.
Music therapy is a great non-pharmacological approach that helps decrease the symptoms in dementia patients. So it can provide decreasing agitation, depression, outbursts that they may experience, especially individuals, as we call it, sundowning. Sometimes that can really help relieve some of those symptoms that individuals get. It also helps with communication, socialization, as far as, sometimes when we play music, we can play it in large groups, especially, sing-along songs, and it also helps with reminiscing maybe times when, certain time periods that they listen to certain songs, or if it brings up, really special memories that contains maybe around their family or friends whenever they were younger. Dementia is one of the most costly diseases. It's also the seventh leading cause of death, followed by cardiovascular disease and cancer. So there's many different kinds and types of dementia. Alzheimer's disease is the most common form, and it makes up about 60 to 80% of all cases. Alzheimer's disease is a neurodegenerative disease. It impairs memory, speech, mood changes, behavior changes, and it really wasn't studied until about the 1970s, and then finally placed into the DSM-5 as a major neurocognitive disorder. So it really has been more recently studied over the last about 100 years, where there have been more studies based off of it, and really trying to do more research in how we can prevent and really treat this disease. There are about 50 million people worldwide that currently suffer from dementia. It is still vastly growing. It does take sometimes a while for the individual to truly get a diagnosis of it. Everybody is affected differently by it. So memory, thinking, orientation, language, speech, all of those things can be affected so differently in all individuals. But one of the biggest things that has been super helpful with this disease is the music therapy. So while medications are beneficial for individuals with dementia, music therapy over the course of many, many studies have shown great significant results in just how individuals have been able to either one, regain maybe a little bit of memory, either calmed their behaviors down, and have been able to redirect maybe possible outbursts with the use of music therapy. There was a study conducted in Oslo, Norway, that revealed some really promising effects of music therapy It ended up decreasing their psychiatric symptoms during that music therapy session, improved their relationships with their partners and significant others, and also promoted good positive behavioral expressions and emotions. There was a former prima ballerina, Martin Gonzalez, from the 1960s, that currently got diagnosed with Alzheimer's disease and was able to remember their dance moves whenever they heard the music of Swan Lake. So, this is just one of those evident positive reactions to music and what kind of significance that it has whenever individuals can listen to a memory or a piece of music even 20 or 30 years prior, that can really help them relive that. I believe even Tony Bennett had a concert recently while he was full blown in his Alzheimer's disease, later within the disease, and he was able to still sing and remember some of those songs that he had sung from years ago. So, a recent study done in 2023 regarding a music program using music and musical activities to determine if they can reduce depression and support cognitive behavioral health. So, there were 45 participants in a dementia daycare type setting. There were 8 sessions, so they went bi-weekly for 60 minutes for 4 weeks. They did music, singing, discussions, and games. The results were kind of a 50-50. So while they did see a reduction in the depressive symptoms, there were no significant changes or improvements in the cognition and behavior. But the positive aspect of this is that it did reduce depression in older adults with dementia, and it does seem that at least a good 50% of that, I mean, even if you can help in just some certain small areas, can really sometimes make the biggest improvements. So even though it was only a small reduction in the depressive symptoms, it's still better than no improvement at all in any of it. And so I think that especially with individuals with dementia, they need to feel like, they have that support, they can reminisce, they can do certain things and activities like that, because sometimes when you just start something small like this, can really grow into something a lot bigger, and a lot of times their mood overall will uplift. They'll be more inclined to go to other activities. They may want to listen to more music. They may be more vocal about things as well.
Music therapy in patients with dementia is a subject that has gained global interest, as a recent study was conducted in Brazil which looked at the effects of music therapy on cognition and neuropsychiatric symptoms in patients with dementia. This study examined 15 patients with dementia in an outpatient center, and they were examined during 60-minute sessions over 12 weeks. The sessions were voluntary to attend, but given this, attendance was still high during these sessions, with 77% of participants attending at least 10 of the 12 sessions. During these sessions, patients were divided into smaller groups and familiar music was played, and participants were able to sing, play instruments, dance, and listen to music. The sessions were not pre-planned, but were instead tailored to and adapted to the moods and desires of the participants during that session. The results of the study showed that there really were no changes or improvements in cognition, quality of life, or burden. However, there were improvements in neuropsychiatric symptoms, including anxiety and motor behavior. The implications that the study has had on this topic include demonstrating that individuals with dementia have preserved musical memory when it comes to familiar and favorite songs, even in advanced stages of the disease. This study also shows that anxiety symptoms can be decreased in people with dementia through the use of musical therapy.
Continuing on with our research, music therapy was first brought up with musicians going into hospitals and performing and playing for patients. And it really, overall, the study that had shown is these individuals, the patients, were more calm, stimulating, but in a positive light. Um, Another study that was done involved 30 participants. Those individuals had dementia. They found that the effects of actually songwriting, not so much as listening to the music, but actually having to write out the songs and think of them on their own, saw significant improvements in language functioning, orientation, and memory. And we come to our impact for nursing. So, as nurses, we are the eyes and the ears, of our patients. We interact with them the most, we stay with them the most, we do the assessments, we understand and know these patients very, very well. So, as nurses, if we're in any type of setting, whether it be in hospital or outpatient or even at retirement facilities or skilled nursing facilities, rehab. A lot of these music therapy is going to be so beneficial no matter what setting you're in. So it's a great non-pharmacological option to helping those individuals with maybe some anxiety or nervousness, maybe if they're having some type of procedure or if they're having a behavioral outburst and they're really avoiding on administering medication to that patient. It's a really good option is to play some music that they enjoy listening to, and a lot of times the music will immediately calm that patient down. They'll normally start singing along with them. Sometimes they'll even start dancing to the music. So it really provides a more holistic route, um, and also helps to overall with the caregiver burnout, which can be really significant. It can be a lot for caregivers, especially during that sundowning time. Sometimes around 3 p.m. to about 5 p.m. is a very, very rough time and challenging time for both patient and caregiver. So being able to play some music or even have music involved in some kind of activity, it's going to be really beneficial.
Nurses can implement music therapy into their practice in a variety of ways to benefit this patient population. Group music therapy sessions can be used as they encourage social interaction and facilitate the expression of emotions. Familiar music and/or music that aligns with the patient's preferred music taste can be played to facilitate musical memory. Background music has also proved to be favorable among people with dementia. Group music therapy with movement proved to be one of the most favorable forms of music therapy in patients with dementia. Therefore, as nurses, we should encourage movement such as dancing or clapping with music therapy in these patients.
So overall, in conclusion, is that music therapy has been shown in a multitude of ways that can be beneficial to patients with dementia and Alzheimer's disease. It's so important to incorporate that into our nursing practice, really to help calm individuals down, decrease depression, reduce anxiety, provide a more warming, calming environment, and also to even enhance cognitive abilities, language, participation, also enlighten moods and involve, with reminiscing and memory activities. So, music therapy, all in all, has been such a great change and something that has been a great option versus pharmacological aspects. So if we can really do our best to keep studying this, keep advocating for this, I think that we'll see a great positive change in patients with dementia.